Good afternoon. My name is JGeorge. I stand before you today to discuss a recent trend which has been identified as a potential health risk within the community. The trend I speak of is the rise in occurrence of trichomonas among our older or elderly population. My goal for this presentation is to shed light on these findings and how we as community providers can assist in mitigating trichomonas from existing within a population which is highly vulnerable. In preparing my presentation, I utilized several aspects of a community health assessment model. This allowed me to focus on key aspects of my initiative to better inform the members of the board today. By using a community health assessment model, I was able to collect pertinent data to the cause, analyze the findings in order to develop a report, and disseminate to key members. As a result, the findings will permit me to recruit supporting members and form an advisory board to brainstorm interventions that will aid in our community in identified health needs. In Florida, there are an abundance of retirees, approximately 8.3 million individuals who are age 65 years or older. Approximately half of these retirees are women who have been found to be making some unhealthy choices, specifically with their sexual behavior. As a result, the public health sector is seeing an upswing of sexually transmitted diseases in our older population. In particular, trichomonas, which is the most common, curable, but less reportable and treated sexually transmitted disease. The prevalence of trichomonas infection in the United States is estimated to be 2.3 million among women, as reported by the Centers of Disease Control and Prevention. In addition, trichomonas is the third most prevalent infection found in both new and existing sexually transmitted diseases. This causes us some concern, seeing that our older population is typically not associated with sexually transmitted disease. Over the past 10 years, Florida has seen a significant rise in cases of STDs within its population. At the local level, in 1995, Pasco County alone reported STDs totaling 413 cases, whereas in 2012, that number escalated to 1,247 cases. At the state level, the number of STDs reported rose from 46,873 cases in 1995 to 101,911 cases reported in 2012. On a national level, Florida ranks within the top 10% of states with the highest incident of reported STDs, as reported by the Centers of Disease Control and Prevention. So who is our population at risk? After review of local surveillance measures, a prevalence is found in our community more in the African American women between ages 50 and 85 who are either unemployed or retired. Identifiable social determinants of health include limited education and low socioeconomic status, lack of access or failure to seek care, distrust of the healthcare system, current housing status to include assisted living, senior homes, or living alone, and noncompliance with treatment recommendations. Identifiable disparities include increased age, current morbidities or health status, culture, and/or religion. Pasco County, Florida is located on the west coast of Florida and geographically totals approximately 750 square miles. It has a population of 485,000 people within its boundaries. Of its population, 22.2% is comprised of persons 65 years and older, and 51.4% of those are women. Its culture is primarily Caucasian at 89.9%. However, Hispanic and Latino population is estimated at 13%, and the African Americans are estimated at 5.3%. In addition, the poverty level within Pasco County resides at 13.9%, as reported by the United States Department of Commerce. In Pasco County, there are approximately 200 care facilities that house older adults aged 55 years or older. The residents of these facilities have access to health benefits either through state's Medicaid program or through Medicare and a secondary health coverage. Access to health care and resources for this age group are bountiful. However, specific programs to target trends and health-related concerns, such as the spread of STDs in the older or elderly adult, is minimal. Women in older age groups vary greatly in terms of sexual practices and health behaviors. Very few STD-related support services have been targeted toward the need of the elderly. Older women are perceived to be sexually inactive or are assumed to be in a monogamous heterosexual relationship. Older women are at higher risk of STD acquisition because of physiological changes that may occur naturally as part of the aging process. Estrogen is thought to enhance the pathogenicity of many urogenital microorganisms, which may lead to increased incidence of infection among postmenopausal women receiving hormone replacement therapy. A number of studies have highlighted the fact that at least 80% of trichomonas infections are asymptomatic and can persist for months, while symptomatic trichomonas infections in women can persist for years. In addition, untreated women are at higher risk for getting or spreading STDs, and the infection has been associated with a substantial increase in the risk of HIV acquisition. Women, both older adult and elderly, in Pasco County, Florida, are at risk for knowledge deficiency, health literacy related to sexually transmitted diseases as evidenced by limited programs and resources to educate, diagnose, and treat sexually transmitted diseases in the older population. In addition, women, both older adult and elderly, in Pasco County, Florida, are at risk for infection related to sexual behaviors, as evidenced by increased unsafe sexual practices and increased occurrence of STDs within their community. These community health diagnoses fall in line with Healthy People's 2020 goals to promote healthy sexual behaviors, strengthen community capacity, and increase access to quality service to prevent STDs and their complications. In addition, the proposed program aids in the improvement of successful progression towards two leading health indicators: access to health services and reproductive sexual health. Evidence reports that older adults are traditionally overlooked population in sexual health, as reported by Healthy People 2020. In fact, 29% of people living with an STD, like gonorrhea, chlamydia, syphilis, trichomonas, and HIV and AIDS, are over the age of 50. Older women may be especially at risk for contracting HIV and other STDs because the age-related vaginal thinning and dryness which causes tears in the vaginal area. Older adults, compared to those who are younger, may be less knowledgeable about sexually transmitted diseases and even HIV and AIDS, and therefore are likely to not protect themselves because they perceive themselves not at risk, do not use condoms, and do not get tested. Proposed upstreaming interventions include providing a mobile clinic which moves about the community that provides health literacy at local churches, women's centers, assisted living, and senior care homes on safe sexual practices. This intervention provides a forum in which they can obtain knowledge and the understanding that they will continue to be a risk for STDs and HIV even in their sunset years. In addition to knowledge, the mobile clinic will provide a free to low-cost pelvic exam to test for trichomonas, supply free or low-cost single doses of Flagyl to those who test positive, along with providing access for follow-up exams and adjunct services. By implementing an upstream intervention to address the safe sexual practices and identification of STDs, it provides the necessary levels of prevention by introducing the interventions in stages that promote optimal health and aim to mitigate risk leading to declining health statuses. The primary level of prevention will provide knowledge and information to the community on sexually transmitted diseases and/or trichomonas and the population's risk factor. Evidence shows that with the use of high-intensity interventions such as discussion forums, counseling, and visual presentations and videos, that the occurrence of STDs is reduced related to newly obtained knowledge. These interventions will include discussion forums, brochures, videos, resource numbers for community and public health nurses. At the secondary level, screening, diagnosis for sexually transmitted diseases and/or trichomonas, along with discussion of preventative measures, will be initiated to prohibit transmission and/or acquisition. The mobile clinic will perform functions at specific locations: churches, women's groups at local community centers, assisted living, and/or senior care homes. In addition, it will provide prophylactic adjuncts such as condoms for use. At the tertiary level, providing medications and/or treatment for diagnosed sexually transmitted diseases will occur along with trichomonas, along with access to support groups and resources for ongoing care. This will deliver the single dose of medication for those who test positive for trichomonas and information on local meetings for those who need support in coping with their diagnosis. The potential benefits address the promotion of optimal health and expanded health literacy. As the population ages, it becomes more difficult to recover from illness and infections because immune systems might be compromised by current morbidities and even medications. By detecting, treating, and educating our older female population that just because they have experienced menopause, they should still take measures to protect themselves, seeing that they are more vulnerable in contracting STDs. Knowledge about STDs and sexually transmitted infections could be behavior changing, such as aspects of prevalence, transmission, and details on how to reduce the risk for transmission, help in identifying potential and personal risk, training in common behavior changing processes such as problem solving, decision making, and goal setting, the training and communication surrounding condom use and safe sex practices. Potential challenges could include resistance by the community and providers seeing that other conditions are more life-threatening than the STD in the older individual. Due to this, financial backing may not be as prominent as desired. Resources may be limited due to the perceived lack of importance of the cause. Level of readiness by the community may not be suitable, seeing that the sexual health of the older adult may be considered as taboo. These obstacles have the propensity to be overcome if evidence-based practice and education are presented in a fashion where the material is culturally sensitive and age-specific. Potential sources of program support could come from a Community Preventative Services Task Force organized on behalf of the Florida Department of Elder Affairs, the Florida Elder Advocacy Group, and the Florida Department of Health. Here I've included a program logic model. It includes inputs, which include funding for the program, staffing to run the mobile clinic, supplies needed to run diagnostic testing, and medications to provide those who test positive. Activities include locating the population in need at the women's centers, community support groups, assisted and senior living facilities. The activities will further include screenings for STDs, health literacy assessments, providing sexual behavior modification where needed, education on safe sex practices, and risk factors for the population, along with providing culturally competent forums regarding sexual behavior in the older and elder adult. Outputs would include the creation and/or showing or viewing of educational videos pertaining to sexually transmitted diseases and prevention, informational brochures and posters, creation of a resource hotline or a dial-a-nurse for specific questions regarding sexual practices or symptoms the population could be experiencing, along with providing a free, conveniently located screening, diagnosing, and treatment clinic. Anticipated short-term outcomes include increased safe sexual practices and increased health literacy, along with decreased incidence of STDs and trichomonas among this population. Finally, long-term outcomes include successful prevention and optimal healthy lifestyle and functioning for our senior population. Evaluation of this program will be performed on a 30-day, 6-month, and yearly basis. Based on results, we plan to reassess the effectiveness of the program, make adjustments where needed, and advocate the program further within the community. Successful progress will be defined as an increased health literacy among the senior population regarding their sexual health behaviors and practice, and the decrease of STDs and trichomonas within the population of the community. In addition, the decrease in cost in treatment of STDs would imply that progress is being made. Preventative measures to decrease the occurrence of STDs can minimize the lifelong consequences and healthcare costs associated in treating the nation's top 8 sexually transmitted infections. It is estimated that at the national level, the lifetime cost associated with the number of STDs acquired just within 1 year is approximately $15.6 million, as reported by the Centers for Disease Control and Prevention. In conclusion, the welfare of our older adults and their health status is of utmost importance. The prevalence of sexually transmitted diseases, especially in this population who are already inundated with a plethora of morbidities, does not need to fall victim to such preventable circumstances. The implementation of this program fosters healthy outcomes and health literacy for a population who at times can be lost in an enormous healthcare system. The implementation of the mobile STD clinic provides a service that is not available within the existing community. It offers a convenience to those who are less mobile, profoundly stoic in their health concerns, and at times might feel as being a burden when having questions or concerns about their health, especially with a topic that is not easily discussed with this generation. Continuing to take care of our older generation and their health concerns, regardless of how big or small they may be, will allow us to continue to provide comprehensive, compassionate, and ethical care. Thank you for your time and consideration.